This is the PowerPoint for sheltering the homeless of Erickson. So Erickson has been given a $4 million to $4 million, grant to develop an outpatient mental health treatment for people in the community who are homeless. And they've asked for the two best practices. So my team and I has come up with the two best practices, and we feel as though the two best practices should be substance abuse and mental health treatment. And so, to define substance abuse, we defined it as overindulgence in or dependence upon an addictive substance, especially, of course, alcohol or drugs. Without proper intervention, drug abuse and mental illness can cause one to fall into a downward spiral. So what we would do for on the substance abuse level, we would create a community-based support that isn't mandated and isn't religion-based. It also caters to the individual and their needs. We would have support groups along with medication to aid in fighting against addiction. For example, Suboxone, that is for people who are addicted to heroin, and something as small as nicotine patches to assist people who would like to stop smoking, and of course treatment for alcohol abuse. And mental illness, we did come up with a slogan, and our slogan is addressing the disease doesn't ensure a cure, it simply ensures the disease will be addressed. And so of course, with mental illness, we would be also treating alcohol abuse. It would be therapeutic sessions for mental illness, meetings. We would also discuss self-care within these sessions and within these meetings, and treatment involving could be something as simple, as behavioral therapy and medications that could reduce the desire to want to drink. And so the method. So the methodology used, of course, we used self-reporting because it's most valuable and it's easily accessible to homeless people. And we also sought residents, asking them to how actually they perceive their health. And we also discussed topics such as health and health services, and and we reviewed, all the information that was given, and we reflected upon those narratives. And so, and what we found was people who resided in shelters and people who returned repeatedly classified different types of methodologies and different types of programs useful and some not so useful. So we asked questions that what one was interested in, and finding the best way to obtain the answers, informations to be addressed, identification of a hypothesis or additional sub-questions that will further the knowledge and to build upon the relationship and to make our programs better. Also, we asked about the type of information, qualitative and quantitative data. We also utilized mixed methods that could involve both qualitative and quantitative data, because they both kind of intertwine with each other. Although they're different, they're both interrelated, qualitative and quantitative data. Also, keeping the need to decide, which method we will use in mind, rather qualitative or quantitative. And so to just define quantitative, methods. Typically, they use close-in structured quantitative methods. Typically, use closed-ended structured surveys, structured observation, and existing quantitative documents or reports. And qualitative methods generally uses open-ended questionnaires, open-ended interview questions, focus groups, participant observation, and existing qualitative artifacts. So as I just stated, in a nutshell, they're both kind of interrelated, although one deals with phenomenons and the other one deals with basically numbers. And so our overarching question is, whose job is it to ensure the homeless are informed of the housing opportunity? And also stipulations that we want to know, the stipulations of qualifying or disqualifying one from being sheltered or housed. So data collection. So can assist. We realize that data collection can assist an organization in understanding the connection to their patrons, customers, and employees. So knowing how to read and comprehend the data can aid in catering, to a said group all the better. Data collection allows the individual and the organization to improve almost any aspect of their relationship. And so respecting the data, what we would do is we would use interviews, semi-structured questionnaires and surveys, observations, monitoring the subject's documents and reports, focus groups, and oral histories, basically self-reporting. And so the data analysis, so data gathered will provide percentages of people who receive assistance. The data will monitor the number of people participated in the programs offered, confirm if the programs are useful or not, aid in addressing other issues considered important to the homeless, allow therapists to address reasons as to why one is homeless repeatedly, and how many emergency shelters and transitional housing units are needed. And so another part of data analysis is we would want to address prior living situation, education, veteran status, demographics, age, and disability, to name a few things that we would address in data analysis. And so limitations. So we found a lot of limitations with the study and with this $4 million grant. And so, but just to name a few, we listed creating the space. Where would we put it? What's the ideal location? Like, we wouldn't want to put it in an urban area where people wouldn't have access to transportation, grocery stores, and things of that nature would be too far out for them. Also, we wanted to keep in mind, if we were housing, who the people we were housing, keeping in mind, their criminal record, because some of these people may have pedophilia background and are lawfully, it is illegal for them to be around children. So that would be a limitation. Also, again, transportation. We would want our people, this building or these transitional housing, whatever we would decide to use, we would want them to be in a good area, so that the children that would go there would be able to go to good schools, because we do understand that where you live does decide a lot about the type of education and who's teaching your children and the quality of education. Another limitation would be transitional period. Would it be for a short amount of time? Would it lead to permanent housing? Who would furnish the housing? What about food? Because you can furnish them and then they didn't have food, or they wouldn't have food. So that would be another limitation. A question would be, is the $4 million a reoccurring grant? Like, would it keep flowing in, or once the $4 million was gone, that would be it? Another limitation that I came up with was solar power for electricity. So of course they would need electricity, and so in order not to create a, a reoccurring bill on the city or the state, or the town of Erickson, what we would want to do, we would want to have solar panels to produce that electricity for their homes, supplying clean water for them. And also, what would we do about people who have recidivism behavior? So, what recidivism is when you are a repeat offender or you continue to break the rules over and over again. Do we give up on you? Do we allow you to just be homeless and just not to try to treat your need or help you with whatever we can help you with, rather it's your substance abuse or your mental illness that causes you to commit to be the rule breaker? What would we do with you? So that's a limitation. Mandating hygiene and clean health would definitely be a limitation. If children and working mothers or working fathers and children are going to be living in these homes or units or transitional housings or shelters, however we would label it, hygiene and good clean health would be something that we would all want our community to participate in. And so that would be a limitation, is mandating that people stay clean and mandating having a clean bill of health if at all possible, right? And so health and welfare checks. So realizing that with the homeless population, within a study that we read on, it was a study of 581 people, and 76% of those people were said to have a concurrent diagnosis, which is where they not only are they homeless, but they have a substance abuse problem as well as maybe mental illness. So 76% of the 581 was affected. And so with that, we wouldn't want our people that we are trying to do so much for just in a house abusing drugs, and someone finds them dead, but they've been there for weeks or months on end and things of that nature. So we would a limitation would be welfare and health checks. Would it be the responsibility of the community? Would we hire someone to go out like we do like with a social worker? Like if for example, like if a child or a family needs a social worker to come out, that social worker is supposed to see them at least once a month, or at least so many times within a quarter or whatever. And so would we provide that type of services as well with the welfare and health checks? And also getting them to trust would be a major limitation, because for some of the people, we realize that a lot of them have already been burned by the system, by themselves. They've been mistreated. They've been just in bad situations, human trafficking, just on drugs, just been misused and abused. And so just getting them to trust us would be a limitation. And so the audience. So the people that we want to address is everybody in general. We would like for people to people that are in media, rather it's social media, the news, social workers, primary care doctors, therapists, local housing authorities, HUD, lobbyists, diaper banks, in and everybody. It would be a community effort. It needs to be a community effort in order to assist our community with the homeless. Colleges, because they do a lot of internships. So colleges, sexual hotlines, national child abuse hotlines, any and everybody should be aware of this, because if people are homeless, they may not have access to television, radio, cell phones, or they may not even be connected with other people who's actually connected that understand and know about this $4 million grant that we've been out given. And so another thing about audience, to keep in mind, the main, well, I shouldn't say the main people, but some of the main people that I want to ensure know about the grant is human services and nonprofit organizations. Why? Why? Because nonprofit organization throughout history, right, has always been there advocating on behalf of their vulnerable population, assisting the community, giving back, food banks, and things of that nature. So definitely human services and nonprofit organizations are the main people that we want to ensure know about this program and what's going on and the opportunities that it entails. And so the participants we would say, of course, would be 18 and older, because under 18 you do or you should have a responsible party. But 18 and older, definitely, both male and female, of course, living in their cars, on the streets, residing with other family members with no designated residence of their own, living in shelters, notice pushing carts, having bags and personal belongings within those big bags. And so that's all, folks. And so just to conclude, to ensure people are aware and informed of the opportunities available, it must be a community effort. Qualitative and quantitative research could be utilized to collect the data established in in order to establish a starting point on who should be informed and the basis of where to start implementing policy and protocol. And concurrent disorders, a condition is in which a person is experiencing mental illness and substance abuse. So that would conclude this PowerPoint. Thank you so much and enjoy the remainder of your day.